So let's have a conversation about animal and animal health. And this is...
Speaking of elephants, okay.
Yeah, speaking of elephants. But now we're talking about livestock, the animals that we keep for food. Yep. So when it comes to animal health, and this is a part of AgriTalk where we bring in conversations about food security, agribusiness. Animal health is we've talked about livestock in previous conversations. Livestock, what does it mean to rear livestock? What do we keep animals for? For milk, for meat, for others, hides and skin, for horns, for pride, everything. There are very many reasons. And it therefore means that when you have your animals and your livestock with you, you want them to have the best life so that you can get the best out of them. So there are very many diseases that then come in, and there's a whole issue of disease control, and then there's a whole issue of movement of animals. For example, in the country, you need to get a permit to transport animals from one county to another, and there's a reason for that. It's because you want to make sure that you're controlling movement of animals so that you can control spread of diseases. There's also the continuous monitoring of diseases in various counties, in various sub-counties, to know how they're doing, so that you know if, for example, we are in this particular stage, then this is what is happening in this particular area in terms of disease and disease control. Okay, so moves from counties, goes all the way even into countries as well. Mm-hmm. So, for example, in the region, IGAD countries have a framework on how animals will cross over borders, because they do. We have seen Kenyan animals being arrested in Tanzania because of crossing the borders. But now let's talk about an entire African-wide animal disease control and looking at our resources as a continent. And we bring in an expert. And the man is Professor James Wabacha. He is a veterinarian by training, and he's also a researcher, a development expert in areas of animal health and livestock development. He's practiced clinical and herd production medicine in food animals for over 30 years. He's a trainer. He's authored many publications in animal health and animal health certification. Professor Wabacha currently works as the animal health expert at the African Union Inter-African Bureau for Animal Resources, and they're based in Nairobi, Kenya. Professor Wabacha, good morning, and thank you very much for joining us.
Good morning.
Welcome to the Situation Room.
Thank you so much.
So let's just start with understanding the African Union Inter-African Bureau for Animal Resources. Big name. What does it mean?
The African Union Inter-African Bureau for Animal Resources is a technical office of the African Union Commission that is responsible for development of livestock resources in the African continent. This office traces its beginning in 1951, and it was formed to address the problem of a disease that was called cattle freak. Mm-hmm. In other words, reader pest. Mm-hmm. This disease was devastating livelihoods, productivity of animals in the early years, and this office was put up to coordinate efforts towards control of this very serious disease that was causing even famines in some countries. So that's the beginning of this office. Mm. And since that time, it continues to grow. Initially, it was specifically addressing one disease, but with the time, it grew to deal with other important infectious diseases of livestock. And with the time, it even grew to incorporate other aspects of livestock production, including genetics, feeding, environmental issues, and so on. So,
how were you able to do this? Just looking at the fact that livestock disease is a major issue, communities' livelihoods affected when their livestock are infected and then in most cases die. So what are some of the things that you then were able to do as this office and some of the measures that you were able to then put in place? How exactly did you do this?
thank you. Thank you for very, very, very good question. Knowing where we are as an African Union institution, we work very closely with the regional economic communities. And as you know, regional economic communities also work very closely with the African Union member states. So at the seat where we sit, we work with regional economic communities and they support member states to do the actual field implementation of activities. So the African Union Inter-African Bureau for Animal Resources basically deals with coordination, formulation of policy and strategy frameworks that are then translated into actual field activities and programs by the regional economic communities and our member states. So the initiatives that we do coordinate are led by the African Union member states. Yeah, we drive initiatives that are of interest to our member states. So the people in the field are the veterinarian, the livestock officers in our member states.
Do you also have a monitoring mechanism? For example, in 1951, when you've told us the office was established, it was addressing rinderpest because it was a big problem at the point. Have we had other kind of diseases that have spread across borders? And what kind of monitoring mechanisms does your office have?
At the level of the African Union, one of the very important tools that we are using to monitor what is happening in the countries is a tool we call the Animal Resources Information System. So with this tool, we are continuously collecting data, animal health data from member states. We analyze this data and disseminate the same to member states so that they are able to use the data for decision making in terms of which methods, which approaches, where the disease is. So this is an important tool for us to monitor, to have a feel of what is happening in our member states. We have rolled out this particular system to all our member states, and therefore we are able to listen in so to speak, what is happening at the level of the member states.
How does it work? Let's give us an example of Kenya and how Kenya is using the Animal Resources Information System and feeding into the continental platform.
So basically what happens is that disease reporting and disease detection occurs at the lowest level, at the farm level, at the ward level, at the county level. So there we have veterinarians who are responsible for managing data collection, feeding into the system, and these data get to the central level, that is at the level of the Director of Veterinary Services, then who analyzes and then releases the data to the African Union. Once we receive this data, we look at it again, analyze it, make information out of it, and then share out this data and the information. This is very critical because once this information is shared with member states, it's useful because member states are able then to alert also their neighbors on their disease situation, because this is important for transparency. Because transparency is important both for disease control, because no one country is able to manage the diseases alone. And transparency is also important as far as trading is concerned, because our trading partners would want all the time to know the disease situation in our countries to make decisions as to whether to trade with us or not to trade with us.
Something that occurs to me as I'm listening to this, because this sounds like it's how should I put it? A center that should actually enable, if I may refer to it as an industry, the industry of livestock keeping, a key economic factor on this particular continent. Now, the question I want to ask is, where does one place livestock in this on this continent? We talk about our coffee sector, our tea sector. Other people talk about cocoa. Where does livestock fit into this equation?
This is very interesting. Livestock as a resource. And when I talk about livestock, I'm talking about aquatic resources, animals, because aquatic resources are also animals. We are also talking about wildlife as animals, and then the livestock, the classical livestock we are talking about.
Yes.
And if you think of animal resource as a sector, you will be surprised that this is a sector that contributes greatly to the gross domestic product of most of our countries in the continent. In some countries, the GDP contribution of livestock is well above 50%. In most of the countries, we are averaging about 30%. So we are talking about a sector that we need to support if Africa is going to meet the objectives of poverty alleviation, feeding ourselves using nutrition feed, and improving the livelihoods of people who play a critical role in animal resources value chains. Because in addition to providing feed or food, it also creates employment, and also we got other industries related to the sector coming up. For example, milk processing plants, slaughterhouses, people in feed industries, people in pharmaceuticals. So it's a heavy industry in terms of job creation and feeding the population of this continent.
Just a segue from that, Prof. If we're looking at, because I think the question continually comes up. If we're looking at, around the continent, and say that there are traditional practices which countries survived on before, livestock agriculture being some of those. How significant an impact really can the keeping of livestock contribute to economies of countries on the continent today? How significant is it that something that cannot be ignored?
You cannot ignore, in African continent, you cannot ignore livestock. As I said, the contribution of livestock to agricultural GDP, you are talking about figures well beyond 50%. So if you have developed the sector, then attention must focus on the development of animal resources sector, and for most of us, the livestock sector. So it's a major contributor, as I said, if you are talking about livelihoods, food and nutrition, employment. For some countries, they depend on export of livestock to buy in cereals and fats and all this, and clothes and everything. So if you take, for example, countries in the Horn of Africa, some of them, the contribution of livestock to their GDP some of them is almost 80%. So you cannot ignore this important resource if we have to transform the agricultural sector and improve the economies of our country.
Right.
So there is a business case. There is a business case to support livestock.
What would be the
Yes.
call on? What would be the call on governments? Because I'm looking specifically at then what this particular department coming from the AU has done to make sure that you eradicate certain diseases that then pose as threats to towards livestock, right? What would be the call on governments if we already know that it's possible to to save people from, or rather to save livestock from this infection, and we already know that there's a commercial aspect to it? What would be the call on governments then to make sure that this sector can thrive?
Our governments, our member states have really shown a lot of political commitment as far as the development of agriculture and livestock is concerned. And this is very well articulated in the Agenda 2063 of the Africa We Want, also in the Marabou Comprehensive Agricultural Program, the so-called CADAP. So the political will is there. And if you remember the CADAP program, there was a commitment in Maputo where member states are to spend 10% of their budgets on agriculture. So what I would want to do is to encourage our member states to continue investment in agriculture, because a dollar investment in agriculture has really a huge ripple effect. So I will request member states to continue investing in this important sector.
But then I want to take you on that, Prof. You're saying that there's political commitment. Yes, there's the declaration, there's Maputo, there's everybody. But has it actually translated to practice in terms of looking at the budgetary allocation, looking at the amount of support that member states, let's just look at the regional community countries in the East Africa, the 5 member states, are they putting the money where their mouth is when it comes to livestock production and supporting this sector?
If you look at, there are many competing priorities. If any government, they are there. What we have seen from 2013, when there was that commitment, we have seen enhanced investments in agriculture, and we foresee a situation here with the time we are going to get more and more investments in agriculture in order to realize the benefits from this important sector. I seem to have lost.
You're here.
There's something that I'd like to ask you, Professor. Every time
Yes,
one talks about livestock, and one then, I like your definition. You know, you brought in the whole animal kingdom and ensured that even wildlife is included. Now, herein lies the question and the issue.
Yeah.
Balancing between human habitation and their domesticated livestock and wildlife. It's a debate that doesn't seem to end. What role does this organization play in helping the citizens, the Wananchi, the people whose livelihood borders on our relatives, the wildlife, and how do you ensure that this discussion is continued and the balance is maintained?
Yeah, this is an important area where, as an African Union institution, we recognize livestock, as you have put it very correctly. Mostly you find a lot of livestock in areas, in dry areas, where there is very strong interaction between the wildlife and livestock, and therefore competing for resources, be they water, be they feed, be they pasture. And so what we are doing as an African Union institution is to work with member states to promote policies and strategies that promote sustainable coexistence between people living in these areas and the animals and the wildlife. It's a continuous process, but it is an important area that we do address through appropriate policies, strategies, and we also do support programs that support sustainable management of livestock and wildlife in these areas where the interface is so close and animals and livestock interact almost all the time, with consequences on humans, consequences on wildlife, and therefore we need to strike a balance that allows wildlife to have sustainable coexistence with the human population.
The conversation we're having now is about animal health and looking at how animal health then impacts human health as well. Having a conversation with Professor James Wabacha. He is a veterinarian by profession, researcher, a development expert. He's worked in very many fields on animal health, clinical areas of animal health, and is currently serving as an animal health expert at the African Union Inter-African Bureau for Animal Resources, and they're based in Nairobi, Kenya. We've been talking about the institution and what it does as an arm of the African Union Commission. And now let's talk about the practical areas. There's something that, Prof, you had mentioned, and this is how your office is basically coordinating, gathering and collection of information at the continental level and then sharing that information with the various member states. And you called it the Animal Resources Information System, where you say, for example, in Kenya, you have a system where information is collected at the farm level. Farmers report, that information goes up the ranks in government level up to the Ministry of Agriculture, Livestock, and then it's shared with your office, and then now you disseminate that as well and share information disclosure sort of with other countries. Now, here is a challenge that I see, and I don't know whether you'll see it as a challenge. For many years, we have seen a reduction in the number of extension service providers at local levels. So with the lack of proper extension services, do you believe that the information that is then collected is actually getting to the national level in a timely manner? And B, is it the correct information that's coming to the government level? So suppose there was a disease outbreak somewhere. Would the national level know as soon as possible that there's a disease outbreak?
Thank you for that question. And it's important for us to address ourselves to that because it's important. Resources are scarce. And one of the strategies our member states are using and ourselves are using, given the constraints you have highlighted, is also to work very closely with the communities. And I think when we start talking about One Health, then you see why working with the stakeholders become important. So one of the strategies we use in order to improve reporting is to try and educate livestock keepers, the communities, on disease recognition, the need to report, why they need to report, what benefits they are going to get, in order to address some of the challenges you have raised. But really, what you have said is right. The numbers are low. Of course, that has an effect on reporting of diseases, but we are managing using other approaches to encourage disease reporting because that's the basis of disease control. Yeah, so it's a challenge, but member states are also using other mechanisms to try and reduce the impact of reduced numbers at the field level, working with the communities.
And then the other issue then would be on diseases that are transmitted from animals to humans. And we talk about zoonotics. We even talk about the diseases that have come from animals through other animals into humans and becoming global pandemics. In the case of Africa, how do we check that we don't see such outbreaks happening?
Yeah, so the basic tool we use as member states, as veterinarians, is a tool we call surveillance, looking for diseases. And I talked about our engagement with the communities, engagement with our field officers. So the tool that we use to detect the occurrence of these diseases, the moment they occur, is surveillance. And as we have already said, there are challenges to this. So sometimes you are not able to pick them when they occur, and you pick them very late when they have already gotten into human population. And sometimes you use the human cases as the indicators of disease occurrence in the particular occasion, while you well know the source of the disease is the animals. So these are the challenges, but surveillance as a tool is what we use to allow us to detect these animals as soon as they occur. But we have challenges.
Professor, I want to ask, how common is it to actually have diseases existing in animals, wild and domestic, and at the same time existing in human beings?
Did I get your question?
Let me repeat myself. I'm asking, is it common? And if it is, how common is it to have diseases that you actually have in animals, wild and domestic, also being manifested in human beings?
It's very common.
Yes.
It's very common. If we think about the zoonoses, as they are called, these are diseases with their origin in animals. If you revisit what we are calling the emerging diseases, the diseases that are being reported for the first time, if you look at human cases, about 75% of these diseases have origin in animals. So it's a huge, huge problem. Most of these new diseases have their origin in animals. And therefore, that calls upon us as veterinarians and working very closely with the ministries of health, the public health department, to work closely to manage these diseases, because as you see, they belong to the two worlds, the animal world and the human world. And we need to talk to one another in order to have effective and efficient control systems.
Even as you say that, how close is the work then between governments and institutions and then the local farmers who are taking care of these livestock to be able to know really what is going on? Because even as I ask this question, I think about the whole antimicrobial campaigns that have been done. A lot of times livestock are sick. The individual farmer will go to an agrovet and get to, medication that they know to be right, whereas maybe making the situation worse. So with the information that you've been able to find out, how closely are you working with farmers on the ground who are in close contact with their animals to know what to administer? Is there some kind of universal code of conduct? How does that work?
The issue you have talked about really is a very important issue, because at the late, people have been using the antimicrobials and the development of antimicrobial resistance. It's not sustainable. And therefore, there is very focused global, continental, regional, and national approaches in order to change this kind of approach. And if you look at most of the African Union member states, they have elaborated now the strategies to counter antimicrobial resistance and to have prudent use of antimicrobials. And what we are doing as an African Union institution and as veterinarians is to support this important cause, to educate, create awareness, and to determine the extent of this problem through surveillance. So it's a current effort where member states have really put in a lot of effort. Most of the countries now have elaborated their strategies on how to counter this. And this is important. It proves that there is political commitment to change this scenario. Because at this rate, if we continue using antimicrobials the way we have used them before, is not sustainable. But it's very encouraging that member states have taken it as a priority, and it will definitely has to start with the communities, because that's where antimicrobials are used. Yes, and we are putting in a lot of efforts in educating, creating awareness, and funding programs that do support awareness and surveillance for antimicrobial resistance.
Many communities that rear livestock are very, very much concerned and alert to the health and well-being of their animals. And then there are very many communities in the continent that consume wild animals, as just one of the things that are given. Now, when they're consuming the wild animals, they're not really checking on their disease and how the wild animals are doing. How do you help such communities to monitor the disease transmission among the wild animals? Because you see pictures, and even when you visit other countries, you find wild animals being sold in the market as food. And always the question that lingers in people's minds, especially Kenyans, is, hey, when these people are eating monkeys and such, then what's the chance of them actually getting a disease that's come from the primates onto humans and transmitting that among humans?
Very interesting. The issue of many communities in the continent harvesting or getting their protein portion from wildlife is very prevalent in the continent. And of course, consumption of wildlife will expose them to diseases that are normally affecting wildlife, but with the close contact and the consumption can jump over to humans. Well, it's a huge issue. You cannot sort it out overnight. But what we do is to try and create awareness. You see the cases of Ebola and other issues. So the issue of people consuming wildlife is an issue, but we do support this kind of areas through awareness creation. Because you won't ban this overnight, but you need to create awareness. Just like they talk about the wet market, getting animals to the market, slaughtering them in the market. We know it's associated with issues. So what we do is to try and mitigate the chances of crossover. So it's a process we have to live with for some time, but we need to educate the communities on how to mitigate the risk of getting the spillovers from wildlife and from animals to humans.
Prof, if I may ask, what activities exist on this continent to providing surveillance of diseases that you may find in wild animals? I know there exists one for domestic animals, but wild animals, do we have such a system? And if we do, how does it work?
What we do, the system I talked about earlier, is not very strong. The surveillance is anonymous, is not that not very well developed in most of our countries. But we are receiving reports of surveillance reports from countries. But it's an area that we need to develop further, because as we have talked before, most of these emerging diseases have their origin in wildlife. And you really need to know the situation of these diseases in wildlife if you have to to take care of the spillover to domestic animals and to humans. So it's an area we really need to invest more as a continent, because we are a continent where we have a rich wildlife resource, where the issues of zoonoses, the Ebolas and others, the dengue fever, they are common. So it's an area we would encourage veterinarians and the public health sector also to work together to determine the extent, the occurrence, and even the changes occurring of these viruses in the animal population. So there is a gap there, but we need to think about it more and invest more if we have to be futuristic and avoid future pandemics occurring in our continent.
Let me throw in a controversial one here. Do you think maybe it would be important for governments to constantly review what they've classified as food items? And I say that because of what we know today as classified as food items. A donkey can actually go and be slaughtered in a formal slaughterhouse. A veterinary public health officer will inspect that meat and say this is fit for human consumption, and then it will end up in the butcheries and in the markets. However, very many other wildlife that is being consumed by Kenyans is ending up onto their plates without having gone through an expert eye or an expert inspection. Perhaps if we just classified, look at a country, look at a region and say, in this particular county, people consume this wild animal widely and commonly. So let's also add that into what is classified as food. Say, if you find yourself with this particular animal, you can take it to a butchery, you can bring in a vet who can inspect it and say this is fit for human consumption. Maybe that would reduce the spread of the zoonotics.
That's interesting. Having controlled systems, and I would want to believe even for wildlife that do get into formal markets, must undergo some kind of inspection. Yeah. So about the donkey, if it has been classified as food, for some countries, there is a threat of extinction, which is another issue then also that need to be addressed. So there are two balls here, or several balls you have to juggle with. Yeah. So you eat and you want to conserve it, given it's important in our communities. So the policies that will come in place will need to balance that. You need to eat, but also you need to keep the donkey alive to serve the other purposes in the community.
That's very true. Prof, let's come back to the issue of the One Health initiative, the One Health approach on the continent, and that's what your office is spearheading. What is it about, and what other institutions are involved in this One Health approach?
Having worked in the area of animal health for quite some time now as an institution and as veterinarians, you realize that to address some of the health issues we are confronted with, the rabies, the anthrax, if you talk about diseases that are always occurring in our countries, it becomes a Herculean task for only one sector to attempt to address them. So this is a situation, therefore, that calls for veterinarians and public health officers to work together in order to deal with these common issues. For example, rabies, a disease of dogs, with huge impacts on the health of dogs.
Yep.
But again, if you look at vaccination for dogs, the agriculture sector may not prioritize this. Yeah, because you don't look at a dog as having a role in food security. Yeah. But again, it's a big public health issue. So you really need, therefore, the two to design programs together, do surveillance together, because it's a problem affecting the two. But if you leave it to one sector, it might be neglected. The same case with the emerging and emerging diseases, the same situation. The animals are the source, but the human beings really are receiving the impact of the disease in terms of health, the economy, and others. So this calls upon us to work as institutions with regional economic communities, with global organizations like the OIE, the Food and Agriculture Organization, the World Health Organization, among other institutions. So several institutions are involved in this very important aspect of health management. Because again, we are calling it One Health, collaboration at the country level.
Right.
But also we need the governance to be correct at the continental and at global level, so that we all focus our energy and vision towards addressing the diseases with zoonotic potential.
Thank you very much, Professor. Professor James Wabacha is a research and development expert on animal health and livestock development with the African Union Inter-African Bureau for Animal Resources. Thanks, Prof, for sharing all the knowledge with us this morning.